All right, everybody, my phones are showing 9 o'clock, and so is my computer, so I want to be respectful of everybody's time and go ahead and get started today. I want to start with who I am, because that's always a good thing. My name is Brian Dowd. I'm the Deputy Executive Director over Policy, Operations, and Compliance at the Department of Community Health. And I have pretty much been the business owner for the federally mandated electronic visit verification program for the last 3 years or so. I used to be the program director over waiver programs. So I am a person who is very familiar with all of our home and community-based waiver programs, as well as the Georgia Pediatric Program, which is also applicable to EVV. I want to thank everybody for joining us this Thursday morning at 9 o'clock. This is a pretty early in the morning town hall for us. We try to accommodate various times, but I really just want to tell everybody that it is really important to continue to get your input, comments, questions, concerns related to EVV, and what is most important is your participation. So I and the folks at the Department of Community Health and the fiscal intermediary do appreciate your participation today. It is vitally important. We start every presentation at the Department of Community Health with our mission, which is to provide Georgians with access to affordable quality health care through effective planning and purchasing and oversight. So what are we going to go over today? We're going to do just a DCH EVV overview. We're going to talk about how EVV impacts self-direction. Then I'm going to turn it over to public partnerships so they can do a little bit of an overview for you. Then of their system. Then we'll talk about next steps, and we'll do Q&A following that. We'll look and see how much time we have. Hopefully we'll have more than enough time for Q&A today. So public partnership and DCH are working to integrate the public partnership system with the DCH contracted statewide system, which is NetSmart, or you may have heard TELUS. TELUS is currently rebranding to NetSmart as NetSmart has taken over or purchased TELUS. So we are having bi-monthly meetings to discuss integration. We are talking a lot more frequently than at the bi-weekly meetings. There is email traffic that is going back and forth between us and all the fiscal intermediaries, including public partnership. So we are actively working to get an integrated system between public partnership and the NetSmart state-sponsored EVV system. So what is required by EVV services? And I get this question every day, and I've gotten it every day for probably the last 2.5 years. I was literally just before this presentation responding to somebody on the EVV mailbox, which I'll let you guys know about a little bit later, who was asking about some codes that were not EVV relevant. They were saying, hey, I can't get the EVV system to work for these codes. And I was like, well, that's because those codes aren't part of EVV. So the only thing that is part of EVV and mandated for EVV purposes are personal support services or community living supports. These are the programs here, which are all the home and community-based waivers, SOURCE, CCSP, NOW, COMP, ICWP, and GAP. GAP is a state plan program for children, and since this is a participant directed, it's not really relevant to this town hall meeting because there isn't participant direction in the GAP program. But for all the other waivers, you could possibly be in those waivers, and you could possibly get a host of services in those waivers. But it is only relevant to personal support services and community living supports. So let me give you the questions I get a lot. What about community access individual? Nope, it's not PSS or CLS. That's a different service. What about respite? Nope, it's not PSS or CLS. That's a different service. What about RD2? Which I had to figure out what RD2 was, but it was respite daily. Again, respite is not one of the services that's covered by EVV. EVV is just for personal support services and community living supports. It's also important to note, because this is a great question that I've gotten a lot, which is, what about personal assistance retainer? If those come out of, those are CLS, those are meant to supplement CLS services. When your member can't, it can't be delivered CLS for whatever reason, maybe they're in the hospital, whatever the reason is, you're able to provide that personal assistance retainer to make sure that your staff member continues to get paid and doesn't leave to go work for somebody else, right? So that hasn't changed, nothing about the policies changed. So you can continue to deliver the PAR funds, personal assistance retainer, but that for right now will not be submitted in an EVV compliant manner. One of the other big key changes that we have had of recent is about fixed devices. So initially, the state of Georgia was going to provide, or considering to provide, key fobs or fixed devices. We would provide those only in the case where the employee who needs to clock in and clock out didn't have a smartphone, or the family member or the individual, the member, did not have a landline at their house. Like, they did not have a telephone at their house. I'll tell you, I don't have a telephone at my house. I canceled it many years ago when I realized I did everything via my smartphone, right? So a lot of folks don't have those. So in the instance where you didn't have either, your worker didn't have a smartphone, and there was no possibility of IVR, which is just a telephone, we were considering doing key fobs. But what we have learned is that the industry best practice, and pretty much everywhere, no longer uses key fobs or fixed devices for EVV. It's just not, it's just outdated material and something that is not recommended for use. So what's an alternative? A free phone. That's what an alternative is. So not through DCH, but through a federal service, Medicaid members can get a free smartphone. The smartphone has unlimited texting, it has unlimited calling capacity, and it has way, way more data than is necessary to run the EVV program. So in the unlikely event, and there's not many of these, that you have employees that don't have a smartphone and the member doesn't have a landline, the individual can apply for a free smartphone with 3 minutes, free data. That member can just set that phone in their house and use it like you would have used a fixed device. The employee will come in, use their ID, and clock in and clock out and utilize the functionality of EVV. I do want to warn you that this GA Lifeline website is not working currently, and that is because they are making some significant upgrades to the website. I did get in contact with them. They are very anxious to work members through the process quickly to get them the free phones and get them set up. But they are making some significant improvements to their website. So it's very, right now it's got a lot of text and a lot of weird stuff on it, but I have been told that in the next few days, it should be up and working well.
And Brian, I checked first thing this morning and it seemed like it was brand new and working as of this morning. So maybe it has a little bit of periodic outages if they're still doing updates, but it was okay as of first thing this morning.
Awesome. Yeah, they are absolutely updating it to make it a little fancier and easier for folks to use. But we are in constant contact with the GA Lifeline folks at the department. And when I tell you they are very enthusiastic to get Medicaid members enrolled for these free phones, they are very enthusiastic. So in this instant, or any other instance, if you're interested in obtaining a free phone, to go ahead and reach out to these folks. So now we'll talk a little bit about impacts to EVV for individuals who are self-directed. So what's changing? What's changing is the required use of EVV in capturing EVV required data. So there are 6 points that are federally required: time you clock in, time you clock out, who's receiving the service, who is delivering the service, location, and what services were rendered, or what we call tasks in the system. So that's what's changing. That has to be captured. Time and data tracking via mobile application versus paper timesheet. That is what is changing. And again, this is a federal mandate from the Centers for Medicare and Medicaid Services and our federal legislature. It was a legislative initiative as part of the 21st Century Cures Act. What is not changing? The waiver rules and criteria. I've gotten a ton of questions about, well, there's a provision in the policy manual that says this. Does it still apply? Yes, nothing has changed about the waiver. Nothing has changed about the policy manual because of EVV. The other thing that has not changed, and I get this question pretty frequently, is where you receive services. I get, well, do I have to clock in and clock out at home? No. We recognize that members don't start every service visit at their house. They may start it in a group center, a community access group, or a adult day health center. They may start it in the community at the pharmacy, or they may meet a family member somewhere to pick the individual up. Nothing about EVV prevents that. If it is part of the service delivery model, if you're documenting it appropriately and it's an appropriate clock in and clock out, there is absolutely nothing to worry about there. How much and how your employees are paid are not changing. Claims still go through the GAMIS system, which is the Georgia Medicaid Management Information System, which is just the system that pays Medicaid claims. And that information goes and payment goes back to your FI. So that has not changed. Another question I've gotten more than a couple of times is, what about my fiscal intermediary? Can I change my fiscal intermediary? Yes, that's never changed. So and nothing about EVV prevents you from moving fiscal intermediaries or coming to a new fiscal intermediary. You would do that as you do now by simply contacting your support coordinator or case manager, whoever is doing the case management function for you in the waivers. There were a lot of other common questions and just honestly misinformation that was out there in the participant direction community or self-direction community. So I've done a lot of answering questions that are, we're so confused. Oh, we've learned, we don't know this, we don't know that. One of the things that came out is now we're going to have facial recognition for all clock-ins and clock-outs. You're going to be taking pictures of us. That's just simply not true. And specific to time for care, facial recognition is not a login, so it's not even an option. The other thing I've gotten a lot of is, we know you're tracking us. Are you tracking me? No, nobody is tracking you. We are doing what is federally required, which is marking your location at the time of clock in and clock out. There is no continuous tracking while you're not clocking in or clocking out, before you are clocking in or clocking out, or during the service time. I've had folks kind of like threaten me and say, I want you to know that when after I clock in, I'm turning my phone to airplane mode. I've been like, okay, I don't care. Turn your phone to airplane mode. As long as when you clock in and clock out, you have that location set up. Because again, we're not tracking you during the day. We're not tracking you before or after or during the service visit. We're just using the GPS technology as federally required for clock in and clock out. Another question we've got, which was a great question, is DCH or public partnership providing or paying for equipment? No, we can't do that. We can't provide equipment through the Department of Community Health or PPL. But again, I would refer you to the Lifeline number, which is a federal allowance for a free cell phone with data, text, and usage. If your member needs a phone, they can certainly get that free phone at no cost to you through the Georgia Lifeline program. Another great question is, what about training time? Can we bill for training time? And unfortunately, no, the federal government does not allow that. Another question is, hey, you guys require the member or the member's family or authorized representative to sign out and verify. What if my family member is getting dropped off at a group scenario and they can't sign out? Either there's some sort of limitation where they can't sign out, or there's just, who knows why, but they just can't sign out. That's not a problem. All the systems have a way of essentially overriding that sign out by the member and the family. And it can be monitored and authorized in an administrative capacity. Another big question, and honestly misinformation that I've gotten from the field is, do I have to have a schedule for my employer aid? And I just answered this question this morning too, where someone told me, I'm participant directed, I'm self-directed. I don't have to have a schedule. I got a budget and I get to use it any way I want. And that's simply not true. It's misinformation that is out there. The waiver programs are built on an assessment, which brings a plan of care, and the plan of care authorizes Medicaid units, taxpayer dollar units, that are authorized to meet an unmet need for that member, so they don't have to be in a much more costly institutionalized setting, right? So in order to get to what that unmet need is, you have to have a schedule. You have to know on a weekly, daily, monthly basis where that person needs an aid to come in and where that person doesn't need an aid to come in. It is a requirement of all home and community-based waivers. Now, let me go ahead and say this. Well, what if I hear all the time, well, what if you vary from the schedule? What if I'm supposed to be home at 6 to be the caregiver for my family member and I get tied up at work? Right now, I just call my aide and they work past the scheduled time. That hasn't changed. You still have that capacity to work shorter and longer, and then manage that according to your overall authorization for services or budget. So that has not changed. You still have that flexibility. You should just be working with a schedule. That's very important and a requirement of all home and community-based services. What if my member submits a paper timesheet versus EVV? So when we go mandatory for claims submission with EVV, which will be 10/1/2021, services need to be authorized in an electronic capacity and not via paper timesheet. Another question I've gotten a ton of times from self-directed members is, right now I pay for travel time. Or I've also heard from more than 10 participants now that they bill for extra time as either a bonus for their employees, or as in order to offset some other expense for their employees. I want to be clear for everyone, and I'm trying to spread this message as much as I can. Travel time is not allowed in the CLS or PSS delivered services. You should clock in when the service begins. So if I'm meeting you at Adult Day Health, I would clock in when I get to the Adult Day Health Center or Community Access Group Center. I would not clock in when I'm leaving my house to drive to the Community Access Group Center. That is not appropriate. Travel time is included in the rate methodology for payment already. So we would be double paying you if you were clocking in for your travel time. Also, flex time or extra time does not exist. I cannot emphasize that enough. You should only be billing for when services start and when services end. You cannot add an extra hour or an extra 2 hours because you want to give a bonus for good work to your employee, or because I've had folks tell me that they allow their aides to bill an extra hour because the aides stop on the way home from community access group to purchase a snack for their family member. And that extra hour of payment pays for the snack on the way home. That is not allowed. That is technically fraud. So I want to make sure that folks are sticking to the rules and that there are no problems associated with the program. So please stick to when service begins and when service ends when you clock out. All right, now I'm going to be quiet for a while and turn it over to public partnership. And if you guys just tell me when you need to advance the slides, I'll make sure and do that for you. Make sure to introduce yourself too. Thank you.
Sounds great. Thank you. So good morning, everyone. This is Chantel Talley. I'm with Public Partnerships. You may hear us say PPL. That's our name for short. Public Partnerships is quite long, so if you want to use PPL, that's fine. I'm going to give you an overview this morning of our EVV solution and how that impacts all the participants that are using Public Partnerships or PPL in the Georgia Now and Comp waivers. So who is PPL? So we have a time for care mobile application, and that is our proprietary mobile application for EVV. We launched that mobile application, Time for Care itself, in 2015, and we have had it active in the Georgia program since the launch of that mobile application. Our waiver participants are actually going to start using the Time for Care mobile application on October the 1st for community living support services. It's important for everyone to understand that we will actually make it mandatory officially on October the 1st for EVV services, which is community living supports. In the PPL system, the community living support service codes, those are specific. They're community living support extended, so CLE. Community Living Support Basic, that's CLH. Community Living Support Extended 2 members, CE2. Community Living Support Extended 3 members, CE3. Community Living Support Basic 2 members, CB2. And then Community Living Support Basic 3 members, CB3. I know a lot of acronyms are going across here. As most of our participants know, in our employment agreement, we do have each of the service codes listed along with their actual full title. So that'll help you understand the community living support service codes that are impacted by EVV. We are letting everyone know that we are going to require everyone starting September the 1st to actually use the Time for Care mobile application. So Time for Care is a basic application that satisfies most of the requirements for EVV currently for this program, but things like time track, the location tracking, and the requirements of the employer signature are not turned on right now. So our basic mobile application, which allows for your employees to clock in and clock out, they can also manually edit their time. You can view their timesheets. You can approve them by just hitting a button approve, or deny them by hitting a button deny and putting a note for your employee, is available currently. Starting September 1st, we're going to ask that everyone use that mobile application. And that's going to be in preparation for the EVV system starting October the 1st. We're going to move to the next one. So we do have a timeline of events that we're going to It's okay. That we're going to start for this project. So throughout the month of August, we are going to be offering online Microsoft Teams trainings for both the participants and providers. So both you and your providers can attend. I see we got a couple of providers actually on this training today, in this town hall today. So it's going to be important for you all to sign up. We're going to send out to each one of you how to log in, the dates for those trainings, and we're going to be releasing those dates in July. I think I've spoken to a large majority of you on this call, if not signed you up with PPL. And so I'll be sending those out. I'll also be the person that's going to be completing those trainings. So I'm going to try to do a large number of them throughout the month of August, different times throughout the day to accommodate for schedules. We know you are going to be busy doing your job, taking care of your family members. So we want to make sure that we have options for you. As I said, starting September the 1st, we're no longer going to accept paper timesheets. At this time, I believe we have one person in the entire program that still does paper timesheets, but for any of those folks who may decide they want to switch to them in the coming weeks, you have to start September 1st using the Time for Care mobile application to submit for community living support services. Now, I want to make one note here that our mobile application allows for you to bill for any of the services that are hourly. So some of you already use the mobile application currently for some other services, community access, and some of the other services that are hourly services. You can continue to do that, but what we're letting people know is that for community living support services specifically, starting September 1st, you will have to use our Time for Care application, and that's in preparation for October the 1st, when all of our participants will be required to use EVV, our Time for Care EVV application for the community living support services to enter your time. We can move forward. So on our website, we have, on our Time for Care site, we have videos that actually explain how to use Time for Care. So again, this is going to be the basic Time for Care starting September 1st for everyone who's not currently already using it. And if you decide that you want to switch over now, you're welcome to do that. You can contact our customer service email. You can give our customer service a call. The large majority of you have my contact details, so you can reach out and we can walk you through how to actually use the Time for Care mobile application at this time. And then, as I said, those videos show you step-by-step how to actually submit time, how you're approving time as employers. If you need to deny time, you'll have that instruction. There's also instructional videos on completing the notes. So if you do daily note tracking using our Time for Care, it's going to have those instructions for you. And then those are generic instructions for this part of it. It's pretty basic. It gives you all the instructional tools that you'll need to be able to use the Time for Care application. We can go to the next slide. Next, we're going to talk about our Time for Care EVV. So you're noticing as I talk, there's Time for Care and then there's Time for Care EVV. So as I said before, we don't turn on the Time for Care EVV actual tools until October the 1st. So currently the application is very basic. We call it our classic Time for Care. It's our main standard application for this project. And then once October 1st comes, we're actually going to turn on all those features that I'll be training you all on in August, so you understand how to use those starting October the 1st. But in preparation for October the 1st, we do have on our website our Time for Care EVV guides. So there are guides and videos and tools to help you understand what you would need to do to use the Time for Care EVV solution. We also have a FAQ, a fact document, and with that document, it just answers some of the most basic questions that you may have about Time for Care and some of the rules related to using EVV and Time for Care. Again, you can contact our customer service and for support for Time for Care. Once this project does start on October the 1st, we'll be releasing our actual customer service line that's dedicated directly to EVV. And so you all will have that phone number. If you ever have issues or things like that, you'll be able to call that line, and our customer service agents who are trained specifically on EVV and answering those questions will be able to assist you. As I said, those videos are very interactive, so you'll understand how to go through each of the parts of our mobile application. We can move to the next slide. So as I said before, these are going to be the links to our Time for Care and Time for Care EVV tools. We're going to be contacting you via mail and email. So for those folks that we do have your email addresses, a large majority we do, we'll be emailing you over the coming weeks with additional information about the trainings. As I said, in July, you'll be receiving those. When I'm back in the office, I'm going to go ahead and start scheduling some of those dates and sending those out to you all. And then periodically over the coming months, you'll be receiving communications via email and mail from our team, just letting you know as reminders as we approach September the 1st. In August, we'll be reminding folks that if they haven't signed up for trainings, please do sign up. In July, we'll be letting you know when those trainings are occurring. And then once we hit October the 1st, our team will also continue to reach out all the way through November, sometimes through the middle of the next month, so December. We continue to do that outreach to make sure that people are compliant in using the Time for Care application for EVV for the Community Living Support Services. We can move to the next slide. So a lot of you are going to be asking, well, what do I need to do next? So we would like for you to download the Time for Care mobile application. We would like for you to attend those trainings that we're going to be providing in August. Again, we'll be sending those dates out in July, so you'll have all the dates for the month of August up front, and you can pick any date that you choose. If you say that you can't attend a training, you'll be able to cancel your registration for one and sign up for another one, so we'll have that feature available for you. So we want to make sure that everyone attends those trainings so that you can learn about our Time for Care application. Just so you all know, during those trainings, I'll also just do a basic overview of the enrollment process for your providers. If you have questions, I'll talk to you about how you can contact our customer service, the different ways. If you want to chat our team on our website, all those different things. So I'm going to kind of give a refresher along with our EVV training. And then third, we'll want to make sure that everyone starts using the Time for Care mobile application by September the 1st at the latest, so that you'll be ready when October 1st comes. If you're already regularly using Time for Care, as I said before, there's only going to be small changes that you're going to see once October the 1st comes. That's going to be a change to how your employee timesheets are approved. So currently, your employee timesheets they have the ability to submit the time, and then you get a notification on our mobile application that your employee has submitted a timesheet to you. You log in, you review all of the time, each of the services, the notes that they submitted, the clock in and clock out times that your provider has put on that timesheet, and then you hit one button, approve. What's going to change is that now, once your employee has completed their shift, they need to then hand the phone to you or the tablet to you, and then you're going to log in with your details, and you're going to enter some demographic details that we'll provide to you, and then you actually have to sign it and hit the approve, the submit button, and basically say that you are in fact approving that time. And that's for each of the shifts that you're going to be doing for your providers. We'll get more into the details in those trainings because there may be some differences that have to happen. Maybe you're not available, maybe you're in the hospital, something like that happens. So we'll talk about what those things are at our training. And then the next thing that's going to change is location tracking of the service at clock in and clock out will need to be turned on. So currently, anyone that's using our Time for Care application, you'll see a pop-up when you log in initially that says, would you like to turn your location services on for this application? And you have the ability to press yes or no. Even if you press no currently, the mobile application will still work. You'll still be able to submit time. What's going to change is that if you do not select yes, your employee is not going to be able to use Time for Care to be able to enter their time for community living support services. It is a requirement through the Cures Act and through DCH mandates, federal mandates, that has to be turned on and tracking has to occur for community living support services. So that will have to be on starting October the 1st for your providers to be able to use the Time for Care application and be compliant with EVV. We can move to the next slide. So how do you download Time for Care? So if you have an iOS, or Android, so most people have an iPhone or a Samsung phone, but there's some other ones, a Google phone, there's different phones out there. But if you have one of those systems, you can go to the App Store, so that could be the Apple Store or the Google Play Store, and you're going to type in the word time, the number 4, and then care. And then you'll be able to download that app. As I said before, it is a free application, so you don't have to pay for it. Your phone may have some settings where you have to put your password in if it's something that's free or not free. But, you know, at the end of the day, the mobile application is free. And once you download that app, you'll be able to use your same username and password that you use for the Better Online web portal to log in with the mobile application. So we made this very seamless for you. You don't have to create a new username and password. Almost everyone in our program has access to Better Online. If you don't, please reach out. Our team can help you sign up. We can give you a link to go do that. Or you can also sign up on our Time Prepare application for a username and password. And then, as I said before, that username and password is going to work for the Better Online web portal. You should be using that currently because that is how you access and view your budget in real time. So you're able to see how much money and funds you have, who your employees are. And you can also view timesheets and e-invoices for any services that you receive. We can go to the next slide. So we do have some communication resources for you. We have a website dedicated for this program. It's for the Now and Comp Waiver Program page. You can definitely go to publicpartnerships.com. At the top of the screen, you can select programs, and then you can click on the state of Georgia and select the Now and Comp Waiver Program page. Once you go on there, we're going to be updating that program page with information related to EVV. So we'll have a separate tab there for you all to click on to be able to access that information. On our program news webpage, it's going to have our guides that are specific to Georgia. So it's going to have the information about community living support services. All our other website tools are really generic and they're basic. How do you use our application? But when you go to our actual Georgia program page, you're going to be able to see how do you use the application specifically for Georgia, for the Now and Comp Waiver programs. You're going to be able to see some of those training guides. You'll also see the actual training dates for the month of August listed on there. Any updates, any changes to any of the rules, any updates to our application are going to be listed there for you. Again, if you have questions about EVV for Georgia and PPL, you can definitely contact our PPL GADDW /CS@pcgus.com email bin. Our customer service agents are there to assist you. Sometimes I'll pop in there and respond to questions. And as I said before, a lot of people do reach out to me directly if they have questions. We can move to the next one.
I think this is where I take over again.
Yes.
Sorry, y'all, there's some animation in this that I didn't realize was in there, so I was having to go in and pause. I'll thank you for that presentation. It was comprehensive and great. So I just really want to say that I want to participate public partnerships communication and their partnership as we go through this EVV process. It is incredibly valuable. So just so you guys know, I want to put some other communication tools out there. We do have a website that is dedicated to EVV. I will tell you that there's different like breakouts, sub pages within the main page, and they were down this morning for some updates, but they should be up by later this afternoon. But the main page is available, which is right here. I don't even have that main page bookmarked. I go to it by going to Google and putting in DCH EVV. And when I do that, it's the first or second thing that pops up. So you can always just go to Google to put in that information. Also, my email address or the email address for EVV, I feel like it's my email address because I'm close to answering 2,000 emails that have come to this website. This email box. Is it evv.medicaid@dch.ga.gov. That's a generic DCH email that we have for all email traffic. It's important that if you're going to want to contact DCH that you go ahead and send the email there because we do track things through that email box. Some of you guys know my normal email address, which is just bdowd@dch.ga.gov, my first initial and my last name. And it's no problem if you send it to my personal email too, but to be most efficient, you're going to want to send it to the EVV mailbox. On that website will be this PowerPoint, along with a recording of today's presentation. And every single town hall we have done since November is on the website, and the recording is on the website as well, including an earlier town hall that we did specifically for self-directed or participant-directed members. So we are trying to be completely transparent. Everything is available on our website. We have flyers and announcements. We have surveys. We have frequently asked questions, and we have a ton more information. So I would encourage you, as an educational piece, just to go to that website, check it out, see what applies to you and what doesn't apply to you. Again, these are our contact information. We're going to go ahead and pause now, and I'm going to look at questions. So I can pull that up. Give me just a second, guys. Okay, Q&A. Got to make this larger because it's in a weird, tiny little format that I can't see. Oh, so much better. What does the slide, the first question is, what does the slideshow, I don't know what that one is, but the slideshow, as I said, will be available on the DCH website. So the slideshow is just an overview specific to public partnership associated with EVV. Has the mandatory date changed from 7/1 to 10/1/2021? So I think I've answered this question to you specifically before, but let me go ahead and answer it again. Maybe I have it confused, and I'm sorry if I do. I apologize for that. So the EVV system is actually up and running and fully functional now. We have providers that are using it. We have third parties that are using it. What has changed is mandatory claims processing was initially scheduled to be required on 7/1, and it will now be required on 10/1/2021. The state of Georgia and DCH has pushed that out for 3 months in order to provide, like Public Partnership said today, a thoughtful training schedule. It's very encouraging to see the different steps that have been built in, so that folks can continue to use it and be comfortable with it prior to the 10/1/2021 date. So we will have further communications out about this later in the week that gives certain times that are associated for all providers, not just participant-directed providers, but traditional providers, with mandatory steps that need to be taken in between the 7/1 date and the 10/1 date. It's also important to note there will be no extensions past 10/1. Our leadership at the Department of Community Health has been very clear about that. So while we're allowed to do a 10/1 extension, they will not allow an extension past 10/1. You will have to have a documented ticket in with the system showing that there is something fundamentally wrong with the system as of 10/1 in order to receive other time. Not just training resources, not just not understanding the system, not just not being afforded going to the trainings and everything else. Okay. The next question I have is, when providers relieve each other in shifts and the participant is physically incapable of signing out and signing in, that's something we covered in this presentation, and it is a great question, so thank you for asking it again. If the member, the participant, is incapable of signing in or signing out, or for whatever reason they can't sign in and sign out and verify the shifts, there is the capacity to do an administrative override of that. So it won't be a game stopper, or it won't mean that that person has to stay signed in. You can do an administrative authorization of that says, hey, the member was at community access group. I wasn't with them to sign in and sign out. They weren't capable of doing it, but the shift did end at this time. Totally understandable, totally allowable, no red flags in the EVV system when that happens. Thanks for asking that question again. It is a good one. Okay, that is all of the chats and questions we have today. So I want to take a second just to thank everyone again for their participation and time today. It is very, very valuable. I want to thank Public Partnership too for their great presentation and cooperation. Thank you, everybody, and I hope you have a great rest of your day and rest of your week.